Welcome to the tour of CHI Health Immanuel Maternity Center. We are located at 6901 North 72nd Street in Omaha, Nebraska. Parking is available in our main parking lot located on the south side of the building. You may enter the building through the main entrance until 8 p.m. You will take elevator A up to the 5th floor. There you will see the entrance to the maternity center. If you enter between 8 p.m. and 5 a.m., you will need to enter through the emergency department. We ask that you bring your photo ID and insurance information when you come in. If you enter through the emergency department, you will need to stop and be registered. When you step off the elevator on the 5th floor, you will see a large waiting area for your friends and your family. You will also see a glass door that says Maternity Center above it. We are a locked unit, so you will need to pick up the phone next to the glass door. Someone will ask if they can help you, and you can tell them the reason for your visit. They will release the door, and you will enter the labor and delivery unit. Visiting guidelines can change according to community needs. Please ask your provider what the latest guidelines are for maternity patients. Our unit has 6 labor and delivery rooms and 6 postpartum rooms and 1 surgical suite. A labor and delivery room is a large private room that has cable television, wireless internet, an oversized bathroom, a closet to store your belongings, a couch which pulls out to a bed, a recliner, a labor bed, fetal and maternal monitors, and an area where we keep our delivery supplies for the baby. We have additional equipment available for our patients, such as birthing balls, squat bars, and peanut balls. In labor and delivery, we have multiple options for pain relief. Some patients choose unmedicated births, others have the option for nitrous oxide, IV pain medication, or an epidural. Communicate your desired option to your nurse. Patients who have scheduled C-sections will also be admitted through the labor and delivery department. Once you have entered our unit, the staff will escort you to the pre-op area where you will be prepared for your C-section. Preparation for the C-section can take up to 2 hours, so your provider will ask that you come to labor and delivery 2 hours prior to the scheduled C-section time. You will be moved from pre-op to the labor and delivery surgery suite when the staff and your provider are ready to deliver your baby. Once the surgery is completed, you will return to the pre-op room and your recovery will begin. Your support person can be with you for the pre-op, surgery, and recovery period. The recovery period after vaginal or C-section delivery will be about 2 hours. During this time, mom and baby will enjoy skin-to-skin contact for the first hour. This is an excellent time to attempt breastfeeding your newborn if desired. The labor and delivery nurse will be happy to help you with breastfeeding if needed. During the second hour of your recovery, the nurse will measure your baby, get their weight, do a full assessment, and give any newborn medications that are ordered. When the recovery period is over, you and your baby will be transferred to a postpartum room. Babies will usually get their first bath between 6 and 24 hours after delivery, to depend upon your request, however, a minimal of 6 hours. At CHI Health Immanuel, we have a rooming in philosophy, and babies will spend most of their time in your room with you. There is a crib for your baby with supplies that the baby will need. Blankets, diapers, wipes, and t-shirts will be stocked in the baby's crib. We suggest you bring an outfit for the baby to go home, a blanket or cover of some type depending upon the temperature outside, and a car seat that has not expired or been in any accidents. It's important that you know how to install and use the baby's car seat. Staff are not allowed to install or place babies in the car seat. For your stay, mom should bring loose-fitting, comfortable clothing, a supportive bra, and toiletries such as toothbrush, toothpaste, deodorant, shampoo, and conditioner, and we supply towels and washcloths. Your support person may also bring toiletries and use the bathroom or shower for themselves if you would like them to. We have a bag of supplies for moms to use after they deliver, which includes disposable underpants, pads, ice packs, and a water bottle for your perinatal care. During your postpartum stay, food service will provide you with a menu, and you are able to choose your meals from this menu. Breakfast, lunch, and supper are served daily, and you may request an additional supper tray for your support person at no extra charge. If you choose to breastfeed your baby, please know that we have lactation consultants, certified lactation counselors, and many experienced nurses to help you. We want to support you breastfeeding your baby. Don't be afraid to ask for help. If you choose to formula feed your baby, we have formula and bottles available at the hospital. How long you stay at the hospital after you deliver will depend on how you and your baby are doing. Between you, your provider, and baby's provider, it will be decided when you and baby will go home. Be sure you choose a provider for your baby before coming in for delivery. At CHI Health Immanuel, we have a doctor who can see your baby while you are in the hospital if you do not have one chosen prior to delivery. We are committed to the safety of our newborns at CHI Health Immanuel. Staff will always wear pink name badges. We have a security system for our babies, and immediately after birth, the baby will have 2 bands placed on them, and a matching band will be placed on mom. There is a 4th band that can be placed on another adult if mom chooses. These bands will stay on mom, the second adult, and baby until mom and baby are discharged from the hospital. At CHI Health Immanuel, we are proud to be a teaching facility that trains future healthcare professionals. It is possible you will come in contact with one of our nursing students, medical students, or residents while you are in the hospital. Please know that all students and residents work close with your provider, and their goal is to provide you excellent care for you and your baby. We know that you have a choice when it comes to healthcare. We thank you for taking this time to visit our maternity center and hope to see you when it's time for you to deliver your baby.